parents, I want to give you a heads up. Our next segment may not be suitable for children. Medical experts estimate it's a condition affecting about 5% of men at 40 years old, then increases to 15% of men at age 70. Coastside Clinic offers surgery-free, drug-free, and non-invasive treatments to help patients dealing with ED. Medical technician Andrew Reinhardt is with us to talk about ED and when men should seek treatment. Good morning, Andrew.
Hey, good morning. How you doing?
So tell us about the medical condition you guys treat and how it affects the quality of life for men and their partners.
Erectile dysfunction is such a sensitive topic, but you're exactly right. It affects the man, of course. It affects the relationship, his significant other. I am yet to meet a man that enjoys taking the pill. That's part of the problem. There's no spontaneity. The man is dealing with headaches and blurred vision the next day. And there are actually studies that say depression and anxiety are higher in men with erectile dysfunction.
Do you find that men will wait to seek out treatment?
Unfortunately, yes. Men typically delay and they try pills or supplements or injections. I think there's a little bit of a stigma around ED. And I think that stigma is dangerous because it holds men back. And the relationship ultimately is what suffers.
Now, what are some of the causes of this medical condition?
Well, we see some of the same things over and over: diabetes, prostate issues, or just a man aging. I will say that it's more normal than you might think. We treat men in their 20s and 30s with erectile dysfunction. We treat men in their 80s and 90s. So if you're out there struggling or your man is struggling, you are definitely more normal than you think.
What can you tell us about your treatment and approach that may be different and unique from some of the traditional ways that this medical condition has been treated?
Coastside Clinic is changing the game when it comes to treating ED. This is a revolution. In fact, it's been called the new standard of care for ED. It's called acoustic wave therapy, and it is clinically proven to use pressure waves, which open up and regrow blood vessels. We're actually treating the root cause problem of erectile dysfunction. Pills and injections, those treat the symptoms. We go to the cause. That means more blood flow, better circulation in the bedroom when it counts. And I think the big attraction is guys don't have to take the pill. They don't have any side effects. There's no pain, and we can do these treatments pretty quickly and easily.
So are your clients finding that this therapy helps?
Oh, yes. It has a very high success rate. They typically say, what a breath of fresh air to not have to take the pill anymore. We hear the word spontaneity, increased intimacy all the time from our patients, and it really lowers the stress when it comes to performance in the bedroom.
So, Andrew, I understand you have a special incentive for some people who may be dealing with this medical condition and want to check you guys out.
We certainly do. If you or your man are out there struggling with erectile dysfunction and want to improve the intimacy, call us right now. The number is on your screen. We will do the assessment, the exam, and the blood flow ultrasound at no charge. You'll get a little gift that I don't think I've ever seen fail. It produces immediate results in the bedroom. All of this is $500, but call us right now. We'll do it totally free.
All right, good information. Thanks for sharing that with our audience, Andrew. And if you would like more about this treatment, you can visit coastsideclinic.com.
This interview involves commercial content. The products and services featured appear as paid advertising.